Welcome to the Hormone Down and Dirty in 30, where I'm going to take about 30 minutes to go over about 12 of your questions that you submitted all about hormones. I know hormones can be confusing. It can feel like herding cats, and I got you. My name is Dr. Carrie Jones. I'm a women's health and hormone expert. Make sure you subscribe down below because you're not going to want to miss all the videos that I have all about hormones, perimenopause, menopause, and this grand transition. So let's jump right in. First question, I'm so confused. How or when or why to take hormones? Great question. Couple things. When we talk about hormones, especially going through perimenopause and menopause, which is what this woman meant, I'm assuming, we are trying to do two things. One, we are trying to accommodate for the symptoms that you're having right now, but we're also planning for the long term. Women spend about a third to half of their life in menopause. So once they stop their period, or once they've had surgical menopause, from that day forward, menopausal, which means hormones have dipped really low. Now, why is this important? When we go through menopause, the active menopause, those hormones play such a big role through our entire system that we have to be careful of what we call the four horsemen or four horsewomen. So it's cancer, cardiometabolic disease, so heart and like diabetes, things like that, neurodegenerative disease, so think Alzheimer's, dementia, diseases of frailty, osteoporosis, break a hip, and that's what we have to focus on. Nowadays, chronic disease, heart disease, metabolic disease, even autoimmune disease, cancer, huge and on the rise. So we're looking at hormones along with all the other lifestyle factors, nutrition, exercise, sleep, your relationships, your mood, your happiness. We combine all those together because we're trying to plan for that last third to half of your life and make sure that you don't break a hip, that you don't develop heart disease, that we reduce the risk of diabetes, we reduce the risk of dementia or Alzheimer's if we can. That's why we're looking at hormones. So when do you start hormones? It's definitely between you and your healthcare practitioner. A lot of women will start to get into hormones around probably their 40s if they still have their ovaries. They usually tend to start with progesterone, and then they can add in estrogen, they can add in testosterone or DHEA, but that sort of gives you an idea of why there's been so much talk lately about hormones. We are thinking of the last several decades of our life as women, and we want to make sure we are supported against those four horsemen. Okay. Can you share why you switch off between prometrium and compounded progesterone? This is a question about me personally, since I had said I started off with prometrium and then I now use compounded progesterone. Can you get compounded progesterone that is not slow release? I was curious as to why you made this choice. So I personally use progesterone. I still cycle, so I personally use progesterone in the luteal phase of my cycle, the second half of my cycle. So I ovulate, and then I will the next day start taking progesterone, and then I will stop it when I get my period or the day before my period. The reason, so prometrium, let me back up. The prometrium is the prescription progesterone you get at any pharmacy. So Walgreens, CVS, Costco, Target, like any pharmacy you can get it. It is bioidentical. It is called oral micronized progesterone, but the trade name is prometrium. And then it comes in 100 or 200 milligrams. It does have peanut oil in it. It does have food dye in it. So if you were sensitive to either of those, be careful. I was noticing that it was helping initially, but it wasn't fully helping me sleep through the night. So it was suggested to me to try a compounded extended release, meaning the 100 milligram was a slow roll through the night to help me sleep through the night. And that worked so much better. So that's why I opted to go the compounded route. That, and it's made without peanut oil and without food dye in it. So that's why I personally went that route. Can you get compounded progesterone, not extended release? Of course, you can compound progesterone however you want. Please do keep in mind with compounded, it's a pharmacy made by a pharmacist who has gone the compounding right. So they can make any dose you need, and they can make it in a capsule, again, that doesn't have binders and fillers and colors that maybe you are sensitive to. So compounding is a great option if 100 or 200 milligrams are not the dose for you. If you need 50 milligrams, if you need 150 milligrams, you can't get that with prometrium. So that's where compounding comes in. You also can't get the extended release. This is where compounding comes in. So it's still the FDA approved progesterone. It's just put in a different dose, or put in without the binders and fillers, or put in as an extended release, so to speak. So those are your options when it comes to progesterone. Is there anything you can recommend for those unable to take hormones during menopause? Unfortunately, due to family history, when I get that life stage, I won't be able to take estrogen, but I still want to be diligent and do my best to protect myself against osteoporosis and other potential issues. Here's what's interesting. Now, I don't know what this person means by family history. Family history is no longer a risk. It is if it's an extended family. If it's an immediate family, mom and sister, then it's a little more of a risk. And even if somebody like your mom tested positive for BRCA, the BRCA genes, or your sister tested positive, like definitely get tested, of course. But there's actually even new evidence to show now that that's not an absolute negative, which I know can be scary. And I know for years, decades, we were taught, oh my gosh, if you have a family history, you can't do hormones. If you tested positive for BRCA, you cannot do hormones. And we're finding that's not actually the case, and it depends on the person. But it does require you to meet with your practitioner and really get counseled over this if this is a no for you, or a maybe for you, or a yes, let's do it and we'll watch and be diligent about it. Here's an example. My grandmother personally died of breast cancer, but that is not a risk factor anymore. It used to be. Back when my grandmother was diagnosed, family history was definitely considered a risk factor. Nobody else in my family has been diagnosed with breast cancer, other than my maternal grandmother. That is not a risk factor anymore. However, if my mom, if I had a sister, if I had tested positive for BRCA, which I have tested, just being in the industry, I am negative. I don't have those two genes, although there are other genes, of course, for cancer. Those are just two big ones that we know about when it comes to breast cancer. So the great thing is, evaluate what do you mean by family history, because it's not an absolute anymore. It might be, but it's not always. So I love this question because I want to make sure that you know sort of the latest up to date on the areas around family history. Now, another question that was very similar was, can someone who has had hormone negative breast cancer in their early 30s safely be on HRT in their 40s? Hormone negative breast cancer. We are finding more and more out about, if you have a history of breast cancer, can you do HRT? So obviously it used to be for decades, like the answer was no, you couldn't be on hormones at all. And now, for example, the North American Menopause Society, due to the research, is suggesting talk with your practitioner, but you could consider vaginal DHEA or vaginal estrogen. And or if it was hormone negative breast cancer, weigh the risks and pros, and then consider it. Because absolutely, I know oncologists out there, integrative oncologists, who say if you had hormone negative breast cancer, and we talk through quality of life, avoiding the 4 horsemen, yes, you can go on hormones, but we have to be very diligent with our monitoring. Obviously, this is controversial, but I do know it's out there. I know the book Estrogen Matters, if you follow Estrogen Matters on social media, on Instagram, they are of a similar opinion that, how long ago did you have cancer? Was it hormone negative or positive? The pros and cons because of the 4 horsemen, quality of life. And remember, when it comes to cancer, estrogen is not single-handedly what causes breast cancer. Cancer is complicated. It's due to a myriad of reasons. And we've had estrogen in our body, in decent amounts since puberty. So it's not just estrogen alone. There's a bigger picture, a bigger answer when it comes to cancer and the causes of cancer. But I do want to say that the North American Menopause Society and even ACOG, the Obstetrics and Gynecology Association, says the vaginal estrogen, vaginal DHEA is okay. And talk to your practitioner if you're hormone negative and it's been a long while on maybe it's right for you. You can also buy that book, Estrogen Matters. That's the name of the book. So I know it's complicated. It's 100% in the gray area. Until you get more detail around like what's going on for you, the reality for you. We can't make blanket statements anymore of like, oh my gosh, had breast cancer, can't do hormones. It's like, well, maybe. And now they're allowing it, in different routes, as opposed to before when they said it was a hard no. So I do want to say that. I did want to answer that question. I think that's really good. Here's the next question. I'm interested in understanding at perimenopause, how do you figure out when to start taking HRT? I'm 53, I have regular periods every month. So I definitely suggest watching my progesterone video here on YouTube, because that may help. What I find anecdotally is that a lot of women will start with progesterone when they still cycle regularly. We don't ovulate like we used to, or we don't produce progesterone like we used to. So symptoms of low progesterone tend to include, I don't feel calm, I'm struggling to sleep, I'm having more anger and irritation, I can't get relaxed anymore like I used to. And even progesterone can play a role in hot flashes. Estrogen gets all of the press, but progesterone can play a role in that as well. We have progesterone receptors all over our body, not just in our uterus. And so for this 53-year-old who still cycles, if you're definitely feeling symptomatic, even with regular cycles, it could be time to start hormones while you're doing lifestyle, nutrition, exercise, supplements, etc., to support this transition. There are other hormones besides progesterone, as I've said before. So we have estrogen, testosterone, DHEA. There's even, it's over the counter, but pregnenolone. I mean, there's a lot of options out there when it comes. You don't have to just start with estrogen. Especially if you have regular cycles, you may be starting with progesterone or DHEA. Or I just did a consult earlier of somebody with regular cycles who's going to start with testosterone. So there are definitely options out there. It just depends on your case. The next question is, should you have your doctor test for hormones? And if so, does it matter at what point in your cycle that you test? So you don't need to test to diagnose, air quotes, right? Diagnose perimenopause or menopause. Testing is not the definition of, at the moment, of perimenopause and menopause. I do find testing is quite helpful, though, for so many things. One, if you still cycle, it gives me a baseline of where you're at. That way we can adjust from there. It also helps. I do particular functional in-depth testing, because I want to see your estrogen and where your estrogen's going. So I want to see estrogen, what we call metabolites. How does your estrogen break down in your body? So before I put you on a hormone, I want to see that information, which is done in a urine test. I want to see your cortisol, and I want to see your cortisol through the day. I want to see your thyroid. I want to see your blood sugar. I want to see your insulin. I want to see your cholesterol. So when you mention testing, I'm assuming this person means hormone testing. And I am testing hormones. Insulin's a hormone. Thyroid is a hormone. Vitamin D is a prohormone, right? Like all these are hormones. Cortisol's a hormone, but they're not estrogen and progesterone. Do I test estrogen and progesterone? Absolutely. I do. Unless her cycles are very irregular, then I test everything else I mentioned and leave those two alone for now. And the reason is because your cycles are super irregular, and it's kind of like shooting it in the dark. But I think testing is important for women because, again, so much is changing. If nobody's tested your cholesterol in years, if nobody's checked your thyroid in years, if nobody's checked your blood sugar, which is glucose, or insulin in years, and then you go into perimenopause and menopause and things go off the rail, I'm not going to know what it was back then. I need to know what it is now and where we're going. I've had more women say to me, I used to have perfect cholesterol. Carrie, I used to have perfect glucose. I used to have a perfect thyroid. And now what happened? And I'm like, I know. This is why I like testing. I don't use it to determine if you're perimenopausal, menopause, and I don't use it to determine can you do hormones? But I do use it to, again, help you thrive and reduce your risk of those four horsemen. Okay, is there a natural form of estrogen? Yes, we have the main two forms I get talked about the most are estradiol, E2, and estriol, E3. Progesterone you can get in a lotion form. Curious if estrogen is that easy as well. It is not that easy. So progesterone, which is bioidentical, you can get over the counter, and a cream, that you or an oil that is roughly 20 milligrams per dose. That's, I believe, the top line the FDA allows. So per dose is 20 milligrams. Whereas then you can get it prescribed, as I mentioned earlier, prometrium, 100 or 200 milligrams, or compounded at any dose you want. Estrogen is not available over the counter, not like progesterone is. It does have to be prescribed from a pharmacy, such as a patch, an estradiol patch. Patches are bioidentical, they're estradiol, or you can have it compounded at a compounding pharmacy. Now, there are synthetic estrogens, such as ethinyl estradiol, the form of estrogen that's in the birth control pill. But I would say most women going through perimenopause, unless they're getting prescribed the pill, which I don't advocate for, but it's your choice. Most women are getting a patch, which is estradiol, which is bio or body identical. So what this person is asking is the natural form. Next question. Do you advocate for balancing the gut to balancing hormones using Chinese Ayurvedic-based tonics? They help me so much with symptoms. I advocate for working on gut health no matter what. I think it's part of the foundation no matter what. If you go into perimenopause, menopause, and you already experience a lot of heartburn or belching or poor absorption or bloating, gas, constipation, diarrhea, your perimenopause and menopause is only going to suffer because of it, because the big transitions in hormones 100% affect from your oral microbiome, your teeth health, your gum health, all the way down to your stomach health, all the way into your small and large intestines. So I advocate for working on anything GI related right away. Like, yes, estrogen and progesterone hormone replacement are great and helpful, but they're not going to solve if you have a lot of absorption issues, if you are eating foods you shouldn't, if you have some sort of GI infection, if you have H. pylori, if you have ulcers, if you have gingivitis, it's not going to solve those. So getting GI support with an integrative or functional or naturopathic doctor is absolutely going to help. Now, as to their question on the Chinese Ayurvedic-based tonics, unfortunately, I am neither a Chinese nor Ayurvedic practitioner. I have a lot of respect for it and have used a lot of their products over the years. However, if that's what your practitioner suggests, and you feel better, then go for it. Okay. Are you, meaning me, are you going to use testosterone and DHEA too? When the time comes, absolutely. Absolutely. So DHEA is a hormone made predominantly by the adrenal glands, but you can also make it, of course, in the ovaries. And DHEA does decline with age, and it can decline with stress. And so I keep an eye on my DHEA. I do test my DHEA and DHEAS levels. There's two forms of DHEA, one with an S, one without. So I do check to see where my levels are at. Testosterone, same thing. My testosterone, the last time I checked, which was earlier 2024, was about in range of what it's been over the many years. So I'm not ready yet for testosterone. I am considering DHEA, adding something like 1 to 5 milligrams in of DHEA. When women use DHEA, we use a lot lower doses than men. We tend to not exceed 10 milligrams, but we start small and then move up. So I am considering DHEA. Now, DHEA is what we consider a prohormone, meaning it can turn into other hormones. So DHEA turns into a hormone called androstenedione, which then can make testosterone, or it can make estrogen. So, and that's tightly controlled in the body. The body tightly controls that. So I would probably start with DHEA, see how I'm feeling, and then keep an eye on my testosterone and go from there. The next question is, what is a compounded cream? Do I like compounded progesterone cream? Is it safe while breastfeeding to help with sleep and mood? So as we were saying earlier, compounding pharmacies use FDA regular progesterone, but they just whip it into a capsule or a cream or a lozenge or whatever form you're using at a specific dose for you. And often the binders and fillers are clean. They don't add in peanut oil or dyes, food dye, and there's a few options that they can use when they compound a cream in this example of what the type of cream is. Maybe it's a gel as opposed to a cream. So there's some pretty neat things that compounding pharmacies can do using regular old progesterone. So that's what a compounded cream is, which is different than an over-the-counter cream that's progesterone. As I mentioned earlier, I believe the FDA tops that out at 20 milligrams per dose. It doesn't mean in the entire jar, there's only 20 milligrams. It's 20 milligrams per dose. Now, the question is safe while breastfeeding, that you will have to talk with your healthcare practitioner about. And the reason I say that is because any type of hormone while breastfeeding, the answer is usually hard no. We don't want anything to cross through the into the breast milk and into the baby. However, we do know that women who've given birth often it's suggested to them to use either the progestin only birth control pill or the progestin IUD as a form of birth control, and that's acceptable when breastfeeding, to do the progestin only birth control pill or the progestin IUD, which that progestin does go through the whole system, go through systemically. So talk with your practitioner, because those progestin is synthetic, options are considered okay when breastfeeding. But you will usually hear that for some reason, progesterone cream, you've got to be careful because it is a hormone. So case by case basis, talk to your practitioner. Last question. What kind of doctor, pharmacist, specialist would I see to get tested and get the stuff that I need for my body? And we'll end on this question because this is such a great question. I've mentioned it earlier, but you want somebody who's pretty hormone trained. You want somebody, and again, if you're thinking, yes, I want hormones and I want to prevent against neurodegeneration, I want to support my gut, I want to talk about exercise and nutrition, I want to learn about the nutrients that I need or anything I'm depleted in, then you're going to want to find somebody who's trained in what we call integrative or functional or naturopathic medicine to help you on this journey. Conventionally, your internist or general practitioner or OBGYN may not be as trained on hormones going through perimenopause and menopause, and they definitely are usually not trained in what to do for your mouth, your gut, your stomach, et cetera. Nutrients, vitamins, minerals, exercise, nutrition, that's usually not their area of expertise. You may also find you need a team. You may find you need your OBGYN 100%, and you have other practitioners that you see to help you on this whole journey. And thankfully, this is becoming more and more of a movement, as it should be, because so millions and millions and millions of women go through perimenopause into menopause all over the world. We cannot opt out of it. And so I'm so glad this education is getting up there. So thank you so much for following and watching along. I hope you learned a lot in these 12 questions that I went through. Again, as I said, definitely subscribe. You're going to learn a whole lot more. Hormones can feel like herding cats, and I'm here to help.